Okay, beta. So, Assalamu alaikum and good afternoon. A very good afternoon. A warm, humid afternoon, but not so bad after the rain yesterday, day before yesterday. Saturday's rain brought a lot of relief from the scorching heat that we've been going through. Acha ji, you must be very surprised to see me because this was basically Dr. Fatima's time, but I have taken up her time because she is kind of unable to deliver a lecture at this time. Okay? For personal reasons, she is not available, so I'll be taking a lecture in her place. In a way, though, it's good. For two straight lectures, we'll finish off with the pharynx, inshallah. Acha ji, pharynx, we've already started doing the pharynx, if you remember. So it's a muscular tube. It's the cranial end or the superior end of the gastrointestinal system, and in fact, the widest part of the gastrointestinal system. It extends from here, from the base of the skull. ये base ही आप समझ लीजिए, base of the skull, and goes down. This is the cricoid cartilage. Okay, so extends down to cartilage. So from the base of the skull, it goes down to the lower border of the cricoid cartilage. Level क्या है? Level 6 cervical vertebrae का है. So widest part of the pharynx is at this level. This is the hyoid bone. Hyoid bone. This is the thyroid cartilage. This is the cricoid cartilage. Okay? And these are the tracheal veins. Okay. So at the level of the hyoid bone, this pharynx is the widest. And at the level where the pharynx continues as the esophagus, that is the narrowest part. So this colored part in three colors, all this is up to here is the pharynx. Starting from the base of the skull down to the lower border of cricoid cartilage, and then this pharynx continues inferiorly as the esophagus. Okay. Excuse me. This is anterior to the pharynx. This is the larynx. So pharynx is the posterior structure, a muscular tube for the passage of food. The pharynx, for convenience, is divided into three parts. Okay? The nasopharynx, oropharynx, and the laryngopharynx. These subdivisions are according to the area, the surrounding area. Okay? This is the nasopharynx in green. It is lying posterior to the nose. This is the nose. So this nasopharynx is lying posterior to the nose. That is why it's called nasopharynx. It extends above, lying above the soft palate. Ye hard palate hai, you can see the bone, and this is the soft palate. So this area above the soft palate is called nasopharynx. The area posterior to the oral cavity, this area in yellow, this is the oropharynx. Okay? It is posterior to the mouth. The mouth hai, and this is the area posterior to the mouth. And then this blue part, the area behind the larynx. Ye larynx hai, this entire thing is the larynx. Starting from here, from the epiglottis, ye sara larynx hai. So posterior to the larynx, you have the laryngopharynx. So just to repeat it, you have this nasopharynx lying posterior to the nose in green. Yellow mein, this is the oral cavity. So the part behind the oral cavity or the mouth cavity, sorry, I'm so sorry, is called the oropharynx. And this part posterior to the larynx. Ye larynx hai sara. Posterior to the larynx, This is the laryngopharynx. By the way, ये जो laryngopharynx है ना, clinicians they called it hypopharynx. ये hypopharynx. This is simply the alternate name to laryngopharynx. We anatomists are so fond of calling it the laryngopharynx. Okay. अच्छा जी. Continue. Let's discuss the anatomy of the nasopharynx. The nasopharynx, as I just told you, is lying posterior to the nose. Okay. So as a result, the nose posteriorly opens into the nasopharynx. The posterior opening of the nose is into the nasopharynx. This is the posterior opening of the nose. This is the nasal septum. The bone forming the nasal septum is the vomer. So this is one nasal opening. This is the other nasal opening. They are opening posteriorly into the nasopharynx. ये सारा part, this part is the nasopharynx. इसमें ये opening है. So these openings, posterior openings of the nose into the nasopharynx, this is called choanae. ये conchae नहीं है बेटा. Conchae lateral wall of the nose, ये conchae है. But choanae is this opening, posterior opening of the nose into the nasopharynx. ये सारा area nasopharynx का है. So posterior opening of the nose into the nasopharynx is called the choanae. Okay. अच्छा जी. अब ये देख लीजिए. All this part is the nasopharynx. Okay. Please note, this was the cribriform plate of the ethmoid. This was the sphenoid bone. Is sphenoid bone में, this is the sphenoidal air sinus. This entire bone is the body of the sphenoid. आपका olfactory tract जो है, it is lying superior to the body of the sphenoid. ये सारा body of the sphenoid है, lying in the body of the sphenoid. This is the sphenoidal air sinus. ये देख लीजिए छोटा सा pituitary fossa. Pituitary fossa is also lying in the body of the sphenoid. ठीक है? अच्छा. So this is the body of the sphenoid and this is the posterior part of the nasopharynx. Now please note, the posterior wall है nasopharynx की, vertebral column and the fascia covering the vertebral column, prevertebral fascia. Now please note that this is the base of the skull. Sorry, this is the roof of the nasopharynx being formed by the base of the skull, the sphenoid bone, and then the posterior wall. They form one continuous sloping surface. So ये junction है basi-occiput, the base of the skull formed by the sphenoid bone. ये sphenoid bone है बेटा, and this is the posterior wall of the nasopharynx. ये, okay. Actually, at the junction of the roof and the posterior wall, that is the basi-occiput formed by the sphenoid or the posterior wall. यहाँ पे at this junction you have a collection of lymph nodules. Head and neck में similar collection. This collection of lymphatic nodules is called a tonsil. और since ये nasopharynx में पड़ा हुआ है, तो it is called nasopharyngeal tonsil या खाली pharyngeal tonsil. आप जो भी कहना चाहें. Okay. So at the junction of the roof and the posterior wall. Okay. This junction पे you have this pharyngeal tonsil. And remember one thing, normal size, a normal pharyngeal tonsil in you and me, that is simply called a pharyngeal tonsil. However, if because of enlargement, any reason, inflammation, any enlargement, etc. If this pharyngeal tonsil gets enlarged, then this enlarged, inflamed pharyngeal tonsil is called adenoids. So adenoids normal nahi hai. As long as it is normal, non-inflamed, it is called pharyngeal tonsil. Once it gets enlarged, once it gets inflamed, it is called adenoids. ठीक है जी, ये भी वही है, ये बेस है, this is the nasopharynx, ये soft palate है, this is the base, posterior wall. इनके junction पे this green structure is the pharyngeal tonsil. जब inflame होगा तो it will be called adenoids. Okay, let's come back to nasopharynx. हमने कहा था the nasopharynx is lying superior to the soft palate. ये soft palate है बेटा. This entire thing is the soft palate. और ये pharyngeal tonsil है. So this is the base of it, base of the formed by the sphenoid bone. Okay. ये sorry, I'm so sorry. This is the pharyngeal tonsil, yeah, nasopharyngeal tonsil. Okay, let me introduce one thing. This is the pharyngotympanic tube. We call it eustachian tube. This is the tube by which the middle ear cavity is connected to the mouth, to the nasopharynx. Purpose ये है कि during swallowing pressure को equalize करता है. ठीक है? It is here to equalize pressure. ये, this is the opening of the pharyngotympanic tube. Okay, and this area around the opening of the pharyngotympanic tube, this also contains a U-shaped area. This also contains lymphatic aggregation, and I told you a lymphatic aggregation in the head and neck, we call it tonsils. So अभी हमने बात की थी pharyngeal tonsil की. Now I'm talking about a tonsil which surrounds the opening of the pharyngotympanic tube. Since ये tube को surround कर रहा है, तो it will be called a tubal tonsil. ठीक है? So अब दो कर लिए tonsils हमने. ये pharyngeal tonsil है over here, and this is the tubal tonsil. अब ये जो pharyngotympanic tube की opening है, medial to this opening, this is a fold of mucous membrane. This fold of mucous membrane is called salpingopharyngeal fold. This is called for a salpingopharyngeal fold because you have an underlying muscle. The muscle underlying this salpingopharyngeal fold is called salpingopharyngeus. Okay? So salpingopharyngeus muscle है. Covering that muscle is the mucous membrane, a fold of mucous membrane. उस fold of mucous membrane को salpingopharyngeal fold कहते हैं. Okay? अच्छे जी. अब यहाँ पे देखिए, lying immediately posterior over here to the salpingopharyngeal fold, immediately posterior to the salpingopharyngeal fold. ये जो है ना, ये देखिए जहाँ पे ये टर्न करके एरो आ रहा है, this dark, this is called pharyngeal recess. Pharyngeal recess. ENT surgeons call it fossa of Rosenmuller. Fossa of Rosenmuller. It is extremely important. Sorry. Very, very important. ये tubal opening है, opening of the eustachian tube है. ठीक है? अब ये simply pharynx extension है, posterior extension of the pharynx है. लेकिन इसकी बहुत इंपॉर्टेंस है बेटा. एट टाइम्स व्हाट हैपेंस इज कि ये pharyngeal recess है या fossa of Rosenmuller है. At times the opening ये है fossa of Rosenmüller, ये तो opening of eustachian tube है. At times eustachian tube block हो जाती है. If you have a untrained ENT surgeon या किसी ENT surgeon के attendant से आप बात कर रहे हो, वो कहता है जी मैं आपकी ट्यूब खोल दूंगा, इंस्ट्रूमेंट डालूंगा उसमें और ट्यूब खुल जाएगी, because a blocked eustachian tube, you all know, can be very irritating. So people go there, especially illiterate people go there. हालांकि the easiest way is कि आप block eustachian tube को just let it be, जो inflammation खत्म होगी तो eustachian tube automatically opens up. But if you have to go and consult somebody, go and consult a senior ENT surgeon. So we were talking about this blocked eustachian tube. In order to open this blocked eustachian tube, if an instrument is passed into it, अब अगर वो instrument slip कर गया, इस tube में नहीं गया, पीछे चला गया, यहाँ पे you have fossa of Rosenmüller क्या pharyngeal recess. Now this pharyngeal recess is extremely important, बहुत खतरनाक है, because posterior to this pharyngeal recess या fossa Rosenmüller, posterior to this you have the internal carotid artery. Instrument slip किया यहाँ से, goes into the pharyngeal recess, और अगर ज्यादा जोर लगा रहा था वो बंदा तो फिर pharyngeal recess की जो mucous membrane है उसको फाड़ता हुआ, it will go into the internal carotid artery, and the internal carotid artery will start bleeding, and obviously उसके बाद जो hemorrhage होगा उसको control करना is virtually impossible. Okay, ये आपका मैं I'm discussing the applied anatomy with it, and I haven't made a separate slide for it. इसकी ज़रूरत नहीं थी. I'm just discussing as we go by. Okay, जी. So now comes the oropharynx. Oropharynx is lying posterior to the oral cavity, इसलिए उसको oropharynx कहते हैं. So this part is the oropharynx. ये सारा part जो है, this is the oropharynx. This part. So it is that part of the pharynx which is inferior to the soft palate. So the soft palate is the superior limit or the superior boundary of the oropharynx. देख लीजिए ये इसकी जो inferior boundary है oropharynx, ये this is the tongue, base of the tongue, ये tongue है सर, ये muscle of the tongue है, ये आपको पेपिले, ये वैलेट पेपिले नजर आ रहे हैं, और ये lymphoid follicles नजर आ रहे हैं. Okay, so superior boundary is formed by the soft palate, inferior boundary is formed by base of the tongue. What you can't see over here are the lateral boundaries. So laterally you have the palatoglossal and the palatopharyngeal arches. मैं अभी आपको दिखा देती हूँ. So extend कहाँ तक करता है? From the soft palate to over here. So ये सारा जो है, this part, epiglottis की superior surface to the soft palate. This entire area is the oropharynx. और ये जो बेटा opening है, which is guarded by this, ये जो opening है, the opening of the mouth cavity into the oropharynx. This opening is called oropharyngeal isthmus. Oropharyngeal isthmus की boundaries please note कर लीजिए. It is the lower surface, yeah, inferior surface of the soft palate, base of the tongue, and on the lateral sides, on either side, you have the palatoglossal folds. अभी आपको वो करवाती हूँ. This is the oropharyngeal isthmus. Please इसको याद रखिए. It is very important because इस पे question आता है या MCQs की सूरत में आता है. या बाउंड्रीज ऑफ द ओरोफैरिंजियल isthmus, ये SEQs में भी आ जाता है. अच्छा जी, if you open your mouth and look at the inside of your mouth in a mirror, this is what you see. This hanging structure is called the uvula. This is the posterior most part of the soft palate. ये soft palate है, and this is the posterior most part of the soft palate, which is called the uvula. Okay. On either side, this is the tongue. So this is the posterior aspect of the tongue, base of the tongue over here. ये आपको valid papillae नजर आ रहा है. So this is the anterior 2/3 of the tongue, and over here you have the posterior part, the posterior 1/3 of the tongue. Now please note, I'm so sorry. You have this fold over here. Anteriorly, you have this fold posteriorly. Anteriorly tongue hai, so the anterior fold will be called, this fold is extending between the palate and the tongue. Okay? So it will be called palatoglossal fold. Between the palate and the tongue is the palatoglossal fold. And then we have this posterior fold. This posterior fold extends from the palate to the pharynx posteriorly. Pharynx posterior पड़ा हुआ है बेटा, इसलिए इसको palatopharyngeal fold कहते हैं. Tongue anteriorly है, so it is called palatoglossal fold. Okay, and between the palatoglossal fold anteriorly and the palatopharyngeal fold posteriorly, this gap is filled by another aggregation of lymphoid tissue. This aggregation of lymphoid tissue is called palatine tonsil, या इसको हम simply tonsil कहते हैं. ठीक है? In a layman's term, the tonsil, कहते हैं tonsil enlarge हो गए, we mean the palatine tonsil. क्योंकि unfortunately pharyngeal tonsil जो है उसको लोग adenoids ही कहते हैं, even though enlarged pharyngeal tonsil means adenoids. अच्छा जी, palatine tonsil का जो टॉपिक है ना, ये that is very very important. मैं इसको इसलिए थोड़ा सा डिटेल में करवा रही हूँ. आपकी बुक में सब कुछ दिया हुआ है जो मैं अब आपको करवाने लगी. Every word of this is taken from your book, even though मुझे इसकी बहुत सी डिटेल्स भी मिल रही थी, but I did not bother. Palatine tonsil is lying between the palatoglossal arch anteriorly, palatopharyngeal arch posteriorly. Yeah, this is palatine tonsil lying between the palatoglossal arch anteriorly और ये palatopharyngeal arch है. ठीक है? It is lying. अब ये जो है ना बेटा, this is the boundary of oropharyngeal isthmus. ठीक है? So superiorly you have the soft palate, inferiorly you have the base of the tongue. On either side you have the palatoglossal arches. Palatopharyngeal नहीं है बेटा. It is bounded by palatoglossal arches. ठीक है? So the oropharyngeal isthmus के lateral side पे you have the palatoglossal arches like this. So this is basically the boundary of the oropharyngeal isthmus. Now, between the palatoglossal and the palatopharyngeal arches, you have this structure, lymphoid follicle aggregation, a collection of lymphoid follicle, which is called palatine tonsil. And this palatine tonsil is lying in this gap between the palatoglossal and the palatopharyngeal arch. This gap is called the tonsillar fossa. इसको tonsillar sinus भी कहते हैं. So be it tonsillar fossa या tonsillar sinus, बात एक ही है. ठीक है? And remember one thing, ये जो आपका tonsil है ना, palatine tonsil, ये इस gap को, tonsillar fossa को, it does not completely fill the tonsillar fossa. In fact, there is some connective tissue, areolar tissue, etc., between the palatine tonsil and the lateral wall of the tonsil. ठीक है, अब ये lateral wall of the tonsil बनती कैसे है? इसको floor of the tonsil भी कहते हैं, इसको bed of the tonsil भी कहते हैं. ये lateral wall होती है tonsil की. ये lateral wall बहुत important है, इसलिए because when tonsillectomy is done, when you remove the tonsils for any reason, तो फिर you have to be very careful not to damage the lateral wall, because a lot of structures are present in the lateral wall or immediately outside the lateral wall. This is drawing. This is more diagrammatic. This is the palatine tonsil. So this has to be the soft palate. Okay? Lateral to the palatine tonsil. Now one by one, from inside out. I'm talking about the structures which are lying lateral to the palatine tonsil. ठीक है? ये mucous membrane है. Mucous membrane है. Outside the mucous membrane, in the connective tissue, you have this vein. ठीक है? Paratonsillar vein. Still outside, you have the pharyngobasilar fascia. अभी करते हैं. You have the pharyngobasilar fascia. And then outside the pharyngobasilar fascia, you have the superior constrictor muscle of the pharynx. And still outside, this is the buccopharyngeal fascia. And on the outside over here, you have blood vessels, you have nerves, you have the glossopharyngeal nerve, you have the vagus nerve, and don't forget, you also have the internal carotid artery lying over here, if it is high enough. ठीक है, मैं wall को दोबारा repeat कर देती हूँ, because आपकी किताब में everything is given, but it is all given at different on the different pages, depending on what is required where. This is the palatine tonsil lying between the palato. This is the palatopharyngeal arch posteriorly. This is the palatoglossal arch. ठीक है? Over here anteriorly. This is capsules. ये जो है, ये this is the capsule surrounding the palatine tonsil. Palatine tonsil has its own capsule, connective tissue capsule. Outside the palatine tonsil and the capsule of the palatine tonsil lying in the connective tissue is this paratonsillar vein. Still outside, you have the pharyngobasilar fascia. Outside the pharyngobasilar fascia, you have the superior constrictor muscle of the pharynx. And outside the superior constrictor muscle of the pharynx, you have the buccopharyngeal fascia. Okay, so these are the layers that form the lateral wall of the tonsil, or the floor of the tonsil, or the bed of the tonsil. Okay, pharyngobasilar fascia, one quick look at it. Yes, superior. Ye muscles of the pharynx, and this entire thing is the pharynx. Okay, these are the muscles. From here up to here, this is the superior constrictor muscle. This. Extending from below the superior constrictor from here to here. This small muscle is the middle constrictor. And this wide muscle below the middle constrictor is the inferior constrictor. And the two constrictors of the two sides, they meet in the midline to form the pharyngeal raphe. Yeah. Raphe is a midline structure where the muscle fibers of two sides interdigitate. Okay? So this is the pharyngeal raphe. So you have the superior constrictor, the middle constrictor, and the inferior constrictor. Above, this is the base-occiput. Yeah, base of the skull. So extending between the base of the skull and the upper border of the superior constrictor muscle of the pharynx. This is a fascia on the inside of the pharynx. This fascia is called pharyngobasilar fascia. Base-occiput से superior constrictor of pharynx, upper border. lining the inside of these muscles. This is the pharyngobasilar fascia. Okay. Oropharynx के arterial supply पे आ जाते हैं जी. The arterial supply of the oropharynx. This comes from the tonsillar branch of the facial artery. ये facial artery है, ये इसकी tonsillar branches हैं. These tonsillar branches of the facial artery, ये देख लीजिए, ये वही है. ये paratonsillar vein है. This is the superior constrictor muscle of the pharynx. ये tonsil का bed बन रहा है, अभी हमने बताया. Pharyngobasilar fascia, superior constrictor muscle of the pharynx. ये buccopharyngeal fascia on the outside. And then on the outside you have the tonsillar branch of the facial artery that pierces the structures present in the muscle in the bed of the tonsil, and then it goes down and supplies the inferior pole of the tonsil. Besides that, we have the ascending palatine branch, we have the lingual branch arising from the, and then tonsillar branch of the ascending pharyngeal artery. ये है, ठीक है. You also have the descending palatine. वो इसमें नहीं दिखती, दिखाई हुई है, ये descending palatine आ गई. ये, ठीक है. ये lingual की branches भी आ गई. So you have all the branches that supply. In दो drawings में you have all the branches that supply the palatine tonsil. So आप देख लीजिए कितने rich palatine tonsil है, and you have to tie all these blood vessels individually in order to remove this tonsil. Okay, venous drainage. Venous drainage. बताया था, bed of the tonsil में you have outside the capsule of the tonsil, you have this vein running between the tonsil and the pharyngobasilar fascia. This vein is the paratonsillar vein. This is also called external palatine vein. This starts from here, the soft palate. This is the soft palate. So it starts from the soft palate, runs on the lateral wall or bed of the tonsil. Pharyngeal plexus. Pharyngeal plexus is simply a plexus of veins on the outside the pharyngeal wall. Tonsillar nerves जो हैं, उनमें they form a tonsillar plexus. This contribution to the tonsillar plexus comes from the vagus nerve and the glossopharyngeal nerve. That is the 9th and 10th cranial nerve. Lymphatic drainage of this tonsil. Lymph nodes जो हैं, okay, and was from my side. Anyway, let's go ahead with the. We finished the oropharynx. I repeat once again, tonsillar nerve plexus. The venous drainage हमने कर ली थी, मैं इसको फिर repeat कर देती हूँ. The venous drainage starts from the soft palate, the vein, paratonsillar vein, also called external palatine vein, runs on the lateral side of the palatine tonsil, outside the capsule of the palatine tonsil. Okay? And then pierces the lateral wall of the palatine tonsil, that is, pierces the superior constrictor muscles, and then drains into the pharyngeal plexus. The pharyngeal plexus forms on the walls, around the walls of the pharynx. Lymphatic drainage जो है, the lymph nodes that drain the palatine tonsil are lying near the angle of the mandible. They are the lateral and inferior group of lymph nodes. Plus, you have jugular digastric nodes. They also drain the palatine tonsil. That is why they are called tonsillar nodes. Tonsil की nerve supply comes from tonsillar plexus of nerves, जिसमें contribution है from the glossopharyngeal and the vagus nerves. Okay. Laryngopharynx. Okay, the lowermost, the inferior part of the pharynx. I told you. This is also called hypopharynx. This part lies posterior to the larynx. It extends from here. Before going this, let me explain these cartilages to you. These are cartilage of the larynx. ये epiglottis है बेटा, ठीक है? And this is the cricoid cartilage. ये सारा, all this block-like cartilage is the cricoid cartilage. This is the cricoid cartilage over here. This is the epiglottis. ये सारा. And please note, this fold, this connects the epiglottis to the lateral wall of the pharynx. ये सारी pharynx की wall है बेटा. This is the muscle of the pharynx. This is the upper part of the superior. This is the middle constrictor. ठीक है? ये constrictor muscles of the pharynx. So this entire thing is the epiglottis that connects. This is the fold that connects the epiglottis to the lateral wall of the pharynx. अब ये extend कहाँ से कहाँ तक करता है laryngopharynx? हमने पहले भी ये बात आपको बताई थी. This extends from the superior border of the epiglottis. ये epiglottis है, ये इसका upper border है. So from the superior border of the epiglottis down to the inferior border of the cricoid cartilage. From here, so from here, superior border of the epiglottis, inferior border of the cricoid cartilage. Okay? And this part of the pharynx, laryngopharynx, is actually resting on the vertebral bodies from C4, 5, 6 cervical vertebrae. C4, 5, 6 cervical vertebrae, this is resting. And this is now the opening of the larynx. Yeah. This, sorry, through this, this is the larynx, cartilage of the larynx. So this is the opening of the larynx. Yeah. Okay. And आपने ये एक basic point पढ़ा हुआ है that during swallowing, this epiglottis comes down, covers this opening of the larynx, and the food from here, this is the mouth, this is the posterior part of the tongue. Food from the mouth slips over the epiglottis and enters into the pharynx. ये walls of the pharynx है. जब ये close करेंगे तो they will come like this. Posterior most walls of the pharynx ये होती हैं. ठीक है? So, otherwise, when you are simply sitting and breathing like you're supposed to be doing now, so this laryngeal opening communicates with the laryngopharynx. ये laryngopharynx है on the outside. ये larynx है. This laryngeal opening communicates with the laryngopharynx. अभी तक do we have any questions? मैंने पूछा नहीं, आपने बताया नहीं. Any questions so far? फिर हम आगे चलें. I guess not. One question? No, ma'am. Thank you. Thank you, Gaur. Thank you so much. जी इमरान, अस्सलाम वालेकुम. कोई बात नहीं बेटा, वो बीच में इंटरप्ट हो गया था तो मैंने इसलिए आपसे कांटेक्ट किया था. मुनीबा ने कर लिया था सॉर्ट आउट. सॉरी, हो गया ओके. अच्छा जी. सो अब हम बात करते हैं. अभी तक वी वर टॉकिंग अगेन एंड अगेन अबाउट द मसल्स ऑफ द pharynx. Let's go down to the muscles of the pharynx. The muscles of the pharynx को बेटा explain करने के लिए simple way is कि you think of 3 tubes. अच्छा, पहले laryngopharynx कर लेते हैं, इसके muscles कर लेते हैं, फिर मैं सारे pharynx के muscles आपको बता दूंगी. Laryngopharynx. This part is the laryngopharynx, so it will be the middle constrictor and the inferior constrictor. ये posterior and lateral walls बना रहे हैं laryngopharynx, ठीक है? And on the inside you have these muscles, जिसमें palatopharyngeus है आपका ये वाला, palatopharyngeus and stylopharyngeus. ये they form the wall of the laryngopharynx. Laryngopharynx में, this is probably the most important structure present in laryngopharynx. ठीक है? अब this is what the piriform fossa is. ये larynx है, ये सारा laryngopharynx है, ये इधर, ठीक है, on either side. ये walls of the laryngopharynx है, middle and inferior constrictor. Okay, this depression on either side of the larynx, this is the piriform fossa. Okay, अब ये देख लीजिए कि ये laryngeal inlet है, ये मैंने आपको बताई, ये laryngeal, ये epiglottis है, ये fold है सारा of mucous membrane, जिसको हम epiglottic fold कहते हैं, retinoid cartilage और epiglottis से lateral wall of the pharynx. This fold actually separates this inlet of the larynx from this lateral structure, which is the piriform fossa. So the piriform fossa, which is a depression lying on either side of the larynx. ये yellow इसलिए किया हुआ कि यहाँ पर extend कर रही है, यहाँ पर. Okay, this is the lateral wall of the pharynx, laryngopharynx. So the piriform fossa, ये जो fold है, fold of mucous membrane covering the lateral side of the epiglottis and cartilages of the larynx. इसमें एक cartilage retinoid cartilage है. So ये जो fossa है, this is separated from the laryngeal inlet by this fold. इसको कहते हैं epiglottic fold. ठीक है? So if you look at it carefully, lateral to the, ये piriform fossa है, medial to the piriform fossa, you have this fold which is called epiglottic fold. ये सारा. It is this fold that separates the laryngeal inlet from the fossa. Okay, ये fold है, epiglottic fold, ये आगे बढ़ जाएगा यहाँ पर. Now this is the hyoid bone. This is the thyroid cartilage. Extending between the hyoid bone and thyroid cartilage is this membrane. So since it is extending between the hyoid bone and the thyroid cartilage, it will be called thyrohyoid membrane. Okay? And I hope you appreciate one thing, that ये piriform fossa है बेटा. So lateral to the piriform fossa, you have thyrohyoid membrane above, and this is thyroid cartilage. So superiorly you have thyrohyoid membrane, and inferiorly you have the thyroid cartilage. They make up the lateral walls of the piriform fossa. ये lateral wall of the piriform fossa. ठीक है? Medial wall is formed by epiglottic fold. And please know कि ये जो walls आपको नजर आ रहे हैं, ये nerves and blood vessels के लिए हैं. This fossa is lined by internal laryngeal nerve, which is a branch of superior laryngeal, which in turn is a branch of 10th cardiac nerve, which is the vagus nerve. So lying deep to the mucous membrane of this fossa. This fossa is lined by mucous membrane, and lying deep to the mucous membrane is the internal laryngeal nerve. This fact is important because if a foreign body may get lodged in this fossa, so अगर इस fossa में foreign body आके हो जाए, if that foreign body happens to be pointed like बच्चों में chicken की bone या fish की bone, like this, it is mentioned in your book, तो उस सूरत में that pointed end of the bone may pass through and through this membrane or cartilage. Hence, it damages the internal laryngeal nerve. When the internal laryngeal nerve is damaged, वो sensitive nerve supply है. If this nerve is damaged, obviously there is complete loss of sensations in the piriform fossa. इससे पहले क्या था? Normal in you and me, in normal people, what happens is, if God forbid any foreign body comes and lodges over here, यहाँ foreign body आके फंस गई, ठीक है? This is mucous membrane, and due to the mucous membrane, you have the internal laryngeal nerve. This internal laryngeal nerve is very sensitive. Sensory supply यहाँ very rich sensory supply है. So this area is very sensitive. As soon as the foreign body comes, this area, in this area, so a reflex coughing starts in order to push the foreign body out. So अगर खाने में कोई चीज गले में फंस जाती है and you start to cough, तो फिर आप समझ लें कि that foreign body went and got stuck over here in the piriform fossa. तो अभी तो ठीक था. Now, if God forbid by any for any reason, if the foreign body is a pointed foreign body or whatever, sharp-ended foreign body gets stuck over here, and which pointed foreign body, it passes through this membrane and damages the internal laryngeal nerve. अब जब internal laryngeal nerve damage होगी तो यहाँ की sensory supply खत्म हो जाएगी. As a result, there will be no sensations left in this area. When there are no sensations left in this area, so if now a foreign body comes and lodges over there, there's going to be no sensations. So no sensation means reflex coughing नहीं होगी और वो foreign body यहीं पे रह जाएगी या it may get dislodged. साथ ही laryngeal inlet है. This foreign body goes and slips into the laryngeal inlet, and then disaster starts. क्योंकि larynx से फिर वो ट्रेकिया और फिर लंग्स में जा सकती है. Is this thing clear? Please मुझे अभी बता दीजिए. मैंने सारी applied इसमें cover कर दिया है, which needs to be done with you people. Is everything clear? Okay, madam. Thank you so much. Thank you so much. If it's clear, then that's happening.